Your feet are swollen right now, and you don't even know why. You worked all day, you finally sat down, and when you look down at your ankles, they look like they belong to someone else. Puffy, tight, maybe even a little shiny. And here's the part that really gets people. You're about to go to bed, and if you don't do anything differently tonight, you're going to wake up tomorrow, and it might still be there. But stick with me for the next few minutes, because I'm going to walk you through 7 bedtime fixes that are actually backed by real medical research, not internet folklore, that can help drain that fluid out of your feet while you sleep. These are the same principles doctors, vein specialists, and physical therapists actually recommend. No gimmicks, no miracle teas, no detox patches, just real science explained simply. Let's get into it. Before we jump into the fixes, let's quickly talk about why your feet swell in the first place, because understanding the why makes the how so much easier to remember. Picture your blood vessels like a highway system. Arteries carry blood down to your feet, and veins are supposed to carry it back up to your heart. But going up is hard work. It's fighting gravity the entire way. Your leg muscles, especially your calves, act like little pumps that squeeze your veins every time you move and help push that blood back upward. Now here's the problem. When you sit at a desk all day, stand at a register for 8 hours, sit on a long flight, or even just live a normal, busy American life, those calf pumps don't get used enough. Blood and fluids start to pool in your lower legs and feet because gravity is winning and your muscle pump isn't helping enough. Some of that fluid leaks out of tiny blood vessels into the surrounding tissue, and that's the puffiness you see and feel. For most people, this is simply what doctors call dependent edema, which just means swelling caused by gravity and position, not a scary illness. But for some people, it can be a sign of something more, like vein disease, kidney issues, or heart problems, which we'll talk about honestly later in this video, because you deserve the full picture, not just the parts that make a good headline. Okay, let's get into the 7 bedtime fixes, starting with the one that has the strongest scientific backing of all. Fix number 1 is elevation. This is the single most recommended, most studied, and most effective way to reduce foot and ankle swelling overnight. Here's how it works, and here's how to actually do it right, because most people do it wrong. When you lie down to sleep, prop your legs up on a pillow or a wedge so that your feet and ankles are positioned above the level of your heart. Not just slightly higher than the bed, actually above heart level. A regular pillow under just your ankles usually isn't enough height. Many physical therapists recommend a foam wedge pillow specifically designed for leg elevation, angled around 6 to 12 inches. Think of it like this. If your blood and fluid pooled downward all day because of gravity, elevation simply reverses that. Gravity pulls the fluid back toward your heart and kidneys, where your body can process and remove the excess. Real-life example. Think about airline pilots and flight attendants who stand for long shifts. Many of them elevate their legs against a wall for 15 to 20 minutes before bed, specifically because they know standing all day causes pooling. You can do the exact same thing. Lie on your back, put your legs up the wall at a 90-degree angle for 15 to 20 minutes before you even get into bed, and then keep your legs slightly elevated with a wedge pillow while you sleep. One important safety note here, if you have congestive heart failure or certain heart conditions, elevating your legs can sometimes cause fluid to shift toward your chest and make breathing harder. So if you have a diagnosed heart condition, please check with your doctor before starting nightly leg elevation. Fix number 2 is compression. If elevation is the gold standard for gravity, compression is the gold standard for supporting your veins directly. Graduated compression socks or stockings are specially designed to be tightest at the ankle and gradually looser as they go up your calf. This design pushes fluid upward, mimicking what your calf muscles are supposed to do naturally. Multiple studies referenced by vascular medicine associations show that graduated compression significantly reduces swelling in people with venous insufficiency, which is a fancy term for when the valves in your leg veins don't close properly and allow blood to flow backward and pool. Real-life example. Nurses who work 12-hour hospital shifts on their feet are frequently advised by occupational health programs to wear compression socks, specifically to prevent evening swelling and leg fatigue. You don't have to wear tight compression stockings to bed if that feels uncomfortable. Many doctors suggest wearing them during the day and switching to loose, breathable socks at night, combined with elevation. However, some people with more significant venous issues are specifically told by their doctor to wear light compression overnight too. The key word here is graduated and medically fitted. Random tight sock elastic bands that dig into your skin, or extremely tight compression without a doctor's guidance can actually restrict blood flow and make things worse. If you have peripheral artery disease, meaning poor blood flow in your arteries rather than veins, compression can be dangerous. So this is another one to clear with your doctor first, especially if you have diabetes or numbness in your feet. Fix number 3 is cutting back on evening sodium. This one surprises people because it's not about your feet directly, it's about your kidneys and how much water your body decides to hold on to. Salt, or sodium, causes your body to retain water as a survival mechanism. The more sodium in your bloodstream, the more water your body keeps around to dilute it. The American Heart Association recommends limiting sodium to around 2,300 milligrams a day for most adults, and even lower for people who already struggle with swelling or blood pressure issues. Real-life example. Think about how you feel the morning after eating a salty restaurant meal, Chinese takeout, canned soup, or a bag of chips late at night. That puffy, bloated feeling isn't your imagination. It's your body holding water because of the sodium load. For dinner, try swapping heavily processed or canned foods for fresh vegetables, grilled chicken or fish, and herbs and spices instead of salt for flavor. This doesn't mean you need to eliminate salt completely or live a bland, joyless life. It simply means being mindful in the hours before bed specifically, since that's the swelling we're targeting tonight. Fix number 4 is staying properly hydrated. And I know this sounds backwards, but it's one of the most important myths we need to break. A lot of people think drinking less water before bed will reduce swelling. In reality, the opposite tends to happen. When your body senses that you're dehydrated, it activates a hormone system that tells your kidneys to hold on to water and sodium as a protective measure. This can actually make swelling worse, not better. Real-life example. Think of your body like a smart thermostat. If it senses a shortage, it overcorrects by hoarding resources. Staying steadily hydrated throughout the day, rather than chugging a huge amount right before bed, helps your kidneys function properly and flush out excess sodium and fluid through normal urination. A simple approach is to drink water consistently throughout your day and taper off slightly in the hour or two before bed, not to avoid water, but just to avoid multiple bathroom trips interrupting your sleep. Fix number 5 is gentle ankle movement and calf activation before bed. Remember how we talked about your calf muscles acting like a second heart, pumping blood upward? You can activate that pump on purpose before you go to sleep. This doesn't require a workout. Simply doing 10 to 15 ankle circles in each direction and 10 to 15 slow calf raises where you rise onto your toes and lower back down while holding onto a chair or counter for balance can help push pooled fluid out of your lower legs before you lie down. Physical therapists commonly recommend these exact movements, sometimes called ankle pumps, for patients recovering from surgery or dealing with poor circulation, specifically because they reduce swelling and lower the risk of blood clots. Real-life example. This is very similar to why flight attendants tell passengers on long flights to periodically flex their ankles. It keeps that muscle pump working even when you're sitting still. Fix number 6 is choosing your sleep position wisely. We already covered elevating your legs with a wedge pillow, but your overall sleep position matters too. Sleeping flat on your back with slight leg elevation is generally considered ideal for reducing swelling because it keeps your body symmetrical and allows gravity to help evenly. Side sleeping is also fine and won't worsen swelling for most healthy people. What doctors do caution against is sleeping in a way that restricts circulation, such as sitting upright in a recliner all night with your legs bent and hanging down, which can actually worsen pooling. Real-life example. Many people who fall asleep in a recliner watching TV wake up with more swelling than people who go to their bed and elevate properly, simply because their legs stayed in a dependent downward position all night instead of an elevated one. Fix number 7 is keeping your sleep environment cool. This one is often overlooked. Heat causes your blood vessels to widen, a process called vasodilation, which allows more fluid to leak out of small blood vessels into surrounding tissue. A bedroom that's too warm, an electric blanket on high, or thick blankets wrapped tightly around your legs can all contribute to slightly worse swelling overnight. Keeping your bedroom around 65 to 68 degrees Fahrenheit, which sleep researchers already recommend for better sleep quality anyway, has the added bonus of keeping blood vessels from overdilating. Real-life example. Think about how your feet and ankles look different after a hot bath or a day at the beach in the summer heat versus a cooler day. Heat expansion is real, and it applies overnight too. Now let's bring this all together. Tonight, before you go to sleep, here's what that routine could actually look like. About 20 minutes before bed, do your ankle circles and calf raises for a minute or two. Then lie down and put your legs up the wall or on a wedge pillow for 15 to 20 minutes while you wind down, maybe while you're reading or scrolling on your phone. Skip the extra salty late-night snack and instead reach for something like fruit or a handful of unsalted nuts. Sip water steadily rather than chugging a huge glass right at bedtime. Keep your thermostat a little lower than usual. And when you actually settle into sleep, keep your legs slightly elevated with that wedge pillow or a couple of firm pillows stacked under your calves and ankles, not just your feet. Now, I promised you honesty in this video, and I want to be really clear about something important. These 7 fixes work well for the most common type of swelling, which is caused by gravity, long hours on your feet, sitting, salt intake, or mild venous insufficiency. But swelling is not always simple. If your swelling comes on suddenly, especially in only one leg, and it's paired with pain, warmth, or redness, that can be a sign of a blood clot called deep vein thrombosis, and that needs emergency medical attention immediately, not home remedies. If your swelling is paired with shortness of breath, chest pain, or a rapid heartbeat, that can be a sign of heart-related fluid buildup, and you need to see a doctor right away. If you're pregnant and notice sudden swelling along with a bad headache, vision changes, or upper abdominal pain, that combination can signal preeclampsia, which requires urgent medical care. And if your swelling has been getting steadily worse over weeks, doesn't improve at all with elevation, or is paired with unexplained weight gain, that's worth a conversation with your doctor to rule out kidney, liver, or heart causes. These 7 fixes are not a replacement for medical care. They are smart, evidence-based habits for common, everyday swelling. If you found this helpful, here's what I want you to do. Try just 2 of these 7 tonight. I'd start with elevation and cutting back on evening salt, since those have the strongest research behind them, and actually pay attention to how your feet feel tomorrow morning. Small, consistent habits like this add up more than people expect. If this video helped you understand your body a little better, hit that like button so more people dealing with the exact same swollen, achy feet can find this video too. Subscribe if you want more simple, doctor-backed health explanations without the hype and without the fake miracle cures. And drop a comment letting me know which of these 7 fixes you're going to try first, or if you have a question about your own swelling. I read every comment and I'll do my best to point you in the right direction. Take care of those feet tonight. You'll be surprised what a difference 20 minutes of the right habits can make.